Welcome to all on this next episode of Spotters and Boosters 13. First, we will discuss the solutions to the SNB12. It was based on MCQs. Question 1 is an aminoglycoside that is used for leishmaniasis is paromomycin. Paromomycin has anti-amoebic activity and it is not absorbed, so it has been used to sterilize bowel in hepatic precoma, and it is effective in leishmaniasis, visceral leishmaniasis to some extent. Question 2 is a beta-lactam antibacterial effective against gram-negative organisms only. Many beta-lactam antibiotics, for example, broad-spectrum penicillins and cephalosporins, have activity against gram-positive and negative, but aztreonam is one which lacks anti-gram-positive activity. Others have an antimicrobial drug that has gastric prokinetic activity. Erythromycin and to some extent other macrolides azithromycin have prokinetic activity due to stimulation of botulinum receptors in the stomach and upper gut. Question 4 is a steroidal topical agent used as antibacterial drug. All these are topical antibacterials: mupirocin, fusidic acid, neomycin, bacitracin. Fusidic acid is the only antibiotic that has steroidal. Gastric acidity is required for anti-ulcer activity of. That means the drug should be activated in the presence of acid, and that is sucralfate, that polymerizes at acid pH to become a viscid thick gel that adheres to the ulcerated crater, protects and prevents from H. pylori damage also. Question 6. A preferred agent for prevention of nausea vomiting during early pregnancy. Here a word of caution is no drug is safe, but among the four, doxylamine along with B6 have been used for several years and has been found to be relatively innocuous. Question 7. This urinary anti-infective drug has shown low resistance despite continuous use for E. coli infection, treatment and prevention. It is nitrofurantoin, and the reason is E. coli mutants, which otherwise would cause resistance to many drugs, also impair bacterial growth. So mutation causes antibacterial activity, and this impairs possibility explains the infrequent occurrence of resistance. This is very unique mechanism of low resistance. Hyperuricemia is an adverse drug reaction seen with the use of pyrazinamide, chlorthalidone and low-dose aspirin, but losartan does not have this effect because it has uricosuric. An antifungal azole effective against mucormycosis. Very few azoles are effective. One of them is posaconazole and isavuconazole. Echinocandins can also be used alone or along with. The drug of choice always remains amphotericin B in the form of liposomal amphotericin B. Question 10 is a macrolide antibiotic that is used as an anti-H. pylori and anti-leprotic drug. Both activities should be there. So the answer is a single dose of this agent is indicated for the treatment of uncomplicated cystitis in women. Phosphomycin is the drug which is given in 3 gram doses to treat the urinary tract infection, that is cystitis in female, but it should be incomplete. As a corollary, many drugs are used as single doses. To remember, azithromycin for gonorrhea, spectinomycin for gonorrhea, phosphomycin for cystitis, amoxicillin 3 gram plus probenecid 1 gram for gonorrhea, less commonly used now, albendazole for roundworm infection, sulfadoxine pyrimethamine for malaria, cetronidazole for amoebiasis. They all have been used as a single dose. Question 12. A preferred antipsychotic drug to treat hallucinations and delusions, that is psychosis occurring in a patient with Parkinsonism with or without levodopa. The answer is pimavanserin, because D2 antagonism is not the main mechanism of action of pimavanserin. one serine, and therefore chances of motor disturbances will be minimal. It acts mainly on the 5-HT2A and 5-HT2C receptor. The last question was matching of the liver damage caused by drug. A large number of drugs cause a variety of liver toxicity. Paracetamol is centrilobular necrosis. Isoniazid is viral hepatitis or bridging necrosis. Statins, an idiosyncratic reaction, may cause acute centrilobular necrosis or cholestasis. Anabolic steroids, particularly methyl derivatives, are cholestatic. Amiodarone may cause steatosis in alcohol like hepatitis, and alcohol is well-known hepatotoxin and may produce a variety of manifestations due to steatosis, steatohepatitis, lobular necrosis to periveneal fibrosis, and ultimately cirrhosis. So this was the key. Now we go to the spot 1. Why is there an instruction shown by the red color in the red color below? Do not combine tablets to achieve a higher strength tablet. Here you have to see that carbidopa, levodopa is given together, but a third drug is also added now as a fixed dose formulation, and the dose of third drug, whether varying doses of co-levodopa are there, but the dose is fixed to 200 milligram. The ratio of levodopa to carbidopa is 1:4, and they come in different strengths, but the dose of entacapone remains 200. So if you take 2 tablets, you are actually double the dose of entacapone, which should remain fixed, and therefore duplication or 2 or 3 drugs cannot be taken together. If its strength is 250, take 1 tablet of that. If its strength is 31.25, 125, take 1 tablet. That is. What is the effect of drug X on the responses shown by epinephrine on the contractile force of the frog's heart? And mention is one therapeutic use. If you look at the drug X, it attenuates the force of contraction shown by. So a cardiac depressant action that opposes cardiac stimulation action of adrenaline is done by beta blockers, namely propranolol, metoprolol, or many others. Now this group of drugs block cardiac beta-1 receptors, so they reduce the force of contraction and cardiac work. And based on this, hypertension is the main indication of propranolol or beta blocker, where reduction in the force of cardiac output and force of contraction reduce. Spot 3 is, what is the purpose of micronization of the progesterone in this formulation? Now this is very important to understand that some drugs must be given in modified dosage forms to achieve. Natural progesterone has high pressure systemic elimination in liver and during its first passage in the other organs after absorption. So that makes it almost useless when given orally. Micronization of progesterone to the particle size less than 10 mm increases the available surface area of the drug and enhances aqueous dissolution rate. So practically it becomes the rate of absorption and elimination becomes independent dose and greater bioavailability and blood levels are achieved. Micronized formulation has a peanut oil in soft gel capsule. Progesterone is lipophilic, stimulates bile salt secretion, and there is an emulsification that makes the water-soluble micelles easily. These micelles, progesterone-containing micelles, are absorbed through lymphatic system, thus bypassing the first pass passage. So it's very interesting way micronization increases clinical efficacy, and virtually all formulations, whether a tablet or capsule, are used as micronized progesterone, not the progesterone as such. What is the source of natural progesterone for therapeutic purpose? Unlike insulin, it is soybean or a yum and not the animal source from where the progesterone is synthesized today. Another question could arise: a synthetic progesterone derivative which has anticonvulsant activity, ganaxolone, Spot 4 is name one anti-anginal drug that shows the effect. The effect is oral ulcerations, particularly ulceration, aphthous ulceration of the tongue. And this is seen with an anti-anginal nicorandil. Although it is uncommon, but painful ulcerations occur in a dose-dependent manner and they disappear when drug is stopped. Spot 5. Enumerate three components of Golgi apparatus and identify the cells that secrete renin. One way from the books also, from the knowledge of physiology as well, the juxtamalleolar apparatus consists of three components. Macula densa, a part of the distal convoluted tubule of the same nephron. Juxtaglomerular cells are known as granular cells which secrete renin, and extraglomerular mesangial cells have also important function. The cluster of the Golgi cells we call granular cells shown in the green secretes renin when macula densa sends signals via ATP to it if concentration of sodium and nowadays chloride ion also plays a role in tubular fluid is high. In the event of high sodium or chloride concentration, this signal reduces renin secretion and vice versa. Now homework for you for SDL 13 is based on ATCOM competencies, enumerate principles of the medical ethics, define the following terms: ethics, empathy, sympathy, compassion, professionalism. You have to find out the answers from the standard textbooks and ATCOM module issued by the NMC. Briefly describe role of effective communication in enhancing adherence to therapy. This may also be found in the module and you may construct a good answer as a short note. If you find it difficult, then you may watch the next episode of the Sports Booster 14. Thank you very much. Happy